everyone and welcome to this video. Today our psychologist Jan Skov will be running through a role play with me playing the client. My name's Hayley, I'm the practice manager and we are from STNA Psychology. The topic that we are going to be talking about today is when you feel a sense of hopelessness about a certain area in your life and you just don't know what to do. So thank you for taking the time to shoot this video, Jan.
Great, thank you. Good morning everyone, and thank you Hayley. Look, Hayley, this is a topic that's particularly interesting to me because what I'm going to talk about this morning is when a client has an issue around their career or their job, a sense of feeling stuck, a sense of they're not going anywhere, maybe they have been in a situation where they've lost their role through a redundancy. And of course that's becoming more and more common nowadays with lots of organisational restructures and so forth. So thank you for being willing to and actually share from your own life in relation to us talking about this issue.
My pleasure.
Yeah. So Hayley, tell me a little bit about a time or even in recent times when you felt quite concerned or frustrated around your career. Would you like to share a little bit about that?
Yeah, sure. So for me, I would say that I have a lot of frustration around knowing my long-term career path, and I feel a lot of frustration and just it feels really hard for me to understand what I really want to do with the rest of my life in terms of a career sense. I really feel like it should be very clear to me and I should know what I want to do. There's so many different things that I love to do, and that makes it really hard for me to kind of figure out how I can settle on one thing in particular and create an actual long-term career path out of that.
Fantastic. Look, you've described it really well, and let me say that I've been in the same position. I think we often have an expectation that we should know. We know this age, I'm in my early 30s and I'm in my 40s and I should know by now exactly what I want to do.
Yeah.
So it's tricky. So when we then, you now, give me some examples of, whether you've actually had professional counselling or whether you've gone to see other people in relation trying to fix this. What did you do to try and fix this problem?
I've spoken to a psychologist before about my career path. And I suppose at this point I still feel like I didn't really get anywhere in that sense, just because, the answer's still really not clear to me.
Yeah, absolutely. So how do you think this therapy works? Do you, how does this, do I fix you? Do you fix yourself in here? How does it actually work?
I suppose I'm hoping that I can get some answers. Yeah, they might be able to help me.
Yeah. I guess if I come back to the idea of fixing you, I'm not a GP that has a pill or some medicine that can actually fix this for you. All right? Often when we have things going on for us inside of us, so in our minds or in our bodies, we think we should be able to fix that. Or, you're used to, if something's going on in your life, something's broken or something's going on with a particular thing outside of your body, you can actually, you're normally able to, you're a very capable woman, you're managing this practice, so you fix things, right? Is that right?
Yes.
So you're used to being able to fix stuff.
Yes, all the time.
Yeah. So there is a sense of frustration there, isn't there, of being stuck. So coming back to how you think this is going to work, how do you think am I going to fix you?
I would hope so.
Yeah. Look, unfortunately the bad news is I can't fix you. I can't fix the problem. All right? So what I'd like you to do is perhaps give me some of the things that give me an idea of some of the things you've done to try and fix this before. Tell me what you did.
I don't know if I could say that I've done specific things to fix it, but what I probably do is I'll get an idea for something that I want to do, and then I'll act on it really quickly. But then I'll find that like my passion or motivation for it burns out pretty quickly. So then I kind of find myself back in the same place again, where I'm back with the same question of what am I going to do?
Yeah.
I don't really have a clear path. I should have a clear path because I am 30, and you know that's what people do. You know, when they get to adulthood, they know what they want to do. All of my friends have really clear career paths. They're all working their way up the ladder, and I just don't really have that sense of direction that they have.
Yeah, understand that. So, did you ask other people for advice? Did they try and help you fix it?
I have tried to seek advice from other people before. To be honest, a lot of the time I just think about it a lot over and over again. So, yeah, that's probably the main thing I've tried so far.
Yeah, all right. Try and give me an understanding a little bit about some of the things that you have actually done. Did you do some research? Did you, what did you do to try and fix it?
I've done some research before on different options. I've looked into different university courses that I could do. I have considered taking different courses at university before. I would say, that's probably...
Did that fix the frustration? Did that fix the worry? Did that fix the, I guess those emotions that you were trying to deal with in trying to look for these different things?
In the moment, I would say it probably did. But then I guess, again, it kind of is short-lived. So I'll kind of feel like I've got a solution, but then it fades away after a little while and doesn't feel like a solution so much anymore.
Yeah. Do you have a sense of frustration still inside of you? A sense of maybe it's sadness, or maybe a little bit of disappointment, or some a sense of not necessarily hopeless, but do you have some sense of any of those emotions and feelings around it?
Yeah, I feel really disappointed with myself and really frustrated with myself that I can't create an answer. I feel like a big failure, and I feel quite hopeless at times.
Are you hard on yourself?
Yeah, I think I am.
So you're hearing that voice inside your head sometimes, like, what's the voice saying to you?
I should be at a certain place by now. I should have a clear career path. I should be, know where I want to be in 20 years' time. I should have had it figured out 5 years ago. That kind of thing.
I can quite sense even a real frustration and a real disappointment in yourself in there. Is that right?
Yeah.
Well, I think that's very common, and I really I can understand that frustration, and I think it's very real, and I think a lot of us have those thoughts about the shoulds and the why don't we know, etc. So I think being able to kind of tap into that part of us that really is understanding of us, and it's actually really difficult, because even when we go and talk to other people about this and talk to even a psychologist, then do they fully understand? Does anyone really fully understand what's going on inside of us? I don't think. I think that's very true. So one of the things that we do with our work is I'll just show this to the people out here. Is we call this mindfulness and story work, and one of the things that we do actually focus on is that all of us inside of us have that wise, mature, understanding, empathetic self, but all of us also in fact have these other parts, you know, our anxious, worrying self, our critical self, you know, our negative, depressed self, our unmotivated, it's too hard self, you know, our sad, hurt self. You know, does that make sense?
Yeah,
Absolutely.
it does.
So, in our work, what we do is we actually start getting an understanding that all those things are going on for all of us. So, with that story work, we start to get an idea that, you know, this is normal. But the other thing is that not only, you know, do we start to think that it's normal and happens for a lot of people, the other thing is to, and this is where we start looking at, you know, at therapy really, is that idea that we need to open up and accept those difficult feelings. Yeah. So, and not, if you like, fight them. Right? Because in fighting them, we end up spending a lot of our energy and time. You know, we ruminate on this, both, you know, in our awake state, and in our, you know, in our sleep state. And the mind still keeps on worrying about this. So, whatever we're trying to solve. So what we try and do is really this idea of not fighting it, but then looking at the idea, how do we then move on from there? And this is really one of the keys, if you like, of one of the types of therapy that we use here, which we call acceptance and commitment therapy. Have you heard of that before?
Yeah, I have.
Okay, good. So really, if we then look at the foundations of acceptance and commitment therapy, it's the idea that we actually open up around those difficult thoughts and feelings and images and stories that we all have. It's impossible to forget those. You know, have you ever tried to forget something and trying to push it away? Very difficult, isn't it?
Yeah,
You know,
it only
because
comes
our
back
mind,
worse.
our mind is an amazing, you know, I guess, tool or mechanism that really holds memories. You know, so hard. So, what it's really about on one level with this is the ability to open up as per, you know, the diagram I showed you before, and really accepting, you know, these, you know, difficult thoughts and feelings that are going on for us, by actually being able to be present and being able to notice those thoughts, notice the triggers that are actually pushing us into those areas of, you know, difficulty. And then the last piece of that, if you like, so opening up around those difficult issues and thoughts, making room for those, accepting them, not fighting them, being aware of when those difficult thoughts and feelings come in, noticing when they come in, and then actually the third leg of the therapy process is really then, you know, doing what matters. Does that make sense to you? Do you think that's a kind of different approach rather than going, hey, I want a pill, I want some technique to fix the problem?
Yeah.
Do you think, does that sound like a different way to approach what you're trying to deal with than what you might have tried before?
It does, yeah. It sounds like it'll take some practice and some changing of my habits.
That's a really good point. And one of the things that we do find in therapy is that people like to come in and then we start to work on these tools to deal with the issues, you know, be more present, you know, doing what matters, and people actually get better. You know, some people get better reasonably quickly, and then, you know, they think, oh, that's great, wow, you know, I've got it, you know. But what we also find is that then if people then discontinue their therapy too early, and they go, oh, I'm feeling much better, you know, I'm right now, and I'll be able to do this, you know, by myself. Often we do find people come back, you know, after some time and go, I'm still struggling. Because this is something new. It's not something that we automatically know and practice every day. It's like a new habit, you know. In a way, sometimes the negative thoughts and feelings that we are dealing with, to some extent, have become just a way of thinking, almost habitual. And so, as we know, habits take a long time to come on and to learn and get stuck in. Just like doing something to work with that is also going to take some time. Yeah. So, have you got any thoughts on that? Does that sound like something which is different? Does it sound like something that you might find useful in what you're trying to deal with in terms of, you know, trying to fix the fact that you don't know what to do with your career and, you know, you should know?
I'm willing to give it a go.
All right. So thank you very much for that, Hallie. Thank you to all of you for listening and tuning in to this broadcast. And we hope to talk to you if you feel like this might be an approach that works for you.